basically we have reading time, that is 5 minutes time. Then we have 40 minutes time to complete a writing task. There will be one profession specific task, right? So the different type of letter that are common: referral, discharge, and transfer, the common types of letter. So basically, in this referral letter, we have discharge letter, we have transfer letter. So normally by concept, what we believe that a letter of referral, when the GP, in case of medicine, is writing this letter to a specialist, or in case of nursing, a person in lower in hierarchy will be writing to a person higher in hierarchy, right? Anyhow, so this is a concept that you might not be able to handle the patient. Now you will refer this patient to the specialist. Now, in case of discharge letter, what we see that, mostly a specialist in case of medicine will be writing this letter back to the GP. So in OET medicine, we can see that he is the primary care physician, right? In case of discharge letter in OET medicine, the general practitioner is normally the primary care physician, right? Or basically, you can see that you are writing this letter back to the primary care physician, okay? Yeah. So basically, this is the main concept of your letter that we can see. In case of nursing, what we can see that maybe a ward nurse is writing this letter to the nursing home or to the community nurse. In this case, the person to whom we are writing this letter, he or she might not know the patient. So the only difference over here, in the both cases, the focus will be your discharge plan, right? The focus will be your discharge plan. Okay, one of the most unique letter is the letter of request. So in terms of request letter, what we can see that we are writing this letter to the person not from your same specialty. Let's say in commonly referral or discharge or transfer letter, doctor is writing to doctor or nurse is writing to nurse. However, in case of request letter, it's something, maybe you are writing this letter to the, maybe you are writing this letter to the social worker, let's say, whatever the situation is. You might be writing this letter to the occupational therapist, right? You might be this writing this letter to the, maybe what we can say, for the writing review, for Department of Veteran Affairs, and so on. So these are the letter of request that we can expect in OET writing. It could be letter to a physiotherapist, to the occupational therapist, to the genetic review, to the palliative care nurse, and so on, right? So these are some of the things that you must keep in your mind before making a decision to what to write and what not to write. Is it clear to you? Afterward, we can see that we also have some other types of letter, which include information letter and which also include the education letter. So these two types of letter are less likely in medicine and nursing. These are mostly related to the pharmacy. Okay. So basically, among those types of letter, the most important thing for you to understand is the marking criteria, because your letter will be based on them. Purpose of writing. What we have in the purpose of writing, we'll discuss. So first of all, is the recipient. Who is receiving this letter? Who is recipient, right? And second thing is, what is the issue? In any particular letter, let's say, in simple word, to whom we are writing this letter, and what is the issue? Why are we writing? In any particular letter. So now consider, let's say, either referral, either discharge, either transfer. You can see that it totally depends upon the person to whom you're writing this letter. Let's say if you're writing this letter to the, like say, letter of referral or any letter, if you're writing this letter to the surgeon, so accordingly things will be changed as compared to if you're writing this letter to the, obviously selection will be entirely changed. Now, what is the issue in case of referral letter? We may have suspected diabetes mellitus, maybe Cushing, and so on. So, or maybe you are writing this letter to discharge this patient with a discharge plan, right? So, this is what we call as a purpose of writing. Commonly held belief is people say that purpose of writing is the introduction. They just mention the purpose introduction. This is not the case. Purpose can be defined, like how we can define the purpose of writing. In simple words, it's your focus of writing task. How organized are you, right? While writing the letter. In simple word, purpose is your focus of writing task. So, second criteria is the content. Now, in the case notes, we have some information that is relevant, some information that is semi-relevant, and some information that is irrelevant. So, no matter what, you should not miss anything relevant. Always write it down, relevant details. But relevance with reference to whom? Again, recipient and the issue. If you have organized the information that should be select, if you have done the selection in this way that you have written the relevant history with reference to the person, and you have not written the irrelevant history, and semi-relevant is optional. Semi-relevant is your option. So, according to the importance of the history, you have to select the relevant case notes. So basically, whatever you will write it down, relevant depends upon focus or purpose, or in simple word, recipient and issue. In simple word, you have to pay focus on the recipient and issue, right? So whatever information that would be relevant for the recipient and for the issue, we have to select. Okay. And if the information is not relevant for the recipient, first of all, and for the issue, you should not write it down together. Okay. So afterward, we can see that there are some information that is semi-relevant. Now, semi-relevant information is such information is optional. You can write or you can omit. It's your call, right? It's totally your call to write it down, semi-relevant information or not. Is it clear to you? Afterward, we can see that we have the next part, that is your organization. In organization of the information, we can see that, like where to write which thing, right? In simple word, where to write which thing? Should we write it down this thing in priority, or should we write this down in less priority? So, according to the recipient and the issue, you have to see which information is written where. And then we have the conciseness and clarity. In terms of conciseness and clarity, the less relevant details should be summarized. One. And clarity means that there must be coherence writing. There must be coherence in your writing, right? So, followed by the next point, that is your genre and style. In genre and style is the transformation. You must have the set of language that should be appropriate for the recipient and for the issue. Number one. Secondly, do not use abbreviation. Abbreviations are not appreciated. So we have the full blood examination should be written as, let's say, and so on. So similarly, your tone should be polite. Okay. Try not to use the word like with. Try to write in full form. And lastly, we have the language part. In language part, we have tenses, sentences, and so on. So these are the marking criteria. She like to ask. See the screen of mine now. So we can see there that we are writing this letter to the primary care physician. And if you are writing this letter to the primary care physician, so we have first of all we can see that past medical history will not be relevant, and we can see that social history will also not be relevant. First of all, then as you can see that this is letter of discharge, so we have a discharge plan to be followed, but you can see the patient has improved after getting the treatment. Can they compensate if medicine? Okay, fine. Now we can start it in the case note from top to bottom. As we are writing this letter to the primary care physician, so this detail will not be relevant. Admission date, discharge date. You can see that discharge date might be important. Diagnosis was schizophrenia. Okay. The past medical history, okay, is not relevant. And the social background, you can see that unemployed and history of police substance use is not important. The only thing is the last abuse, like we can see this is important, right? Right now, but right now it's not. We can see that at the moment we cannot say that is important or not. We can say that okay, it's not relevant. But as you can see there, the one thing that first 3/2018 the patient had admission, and 28 he had his last cocaine use, and this is self admission. So in combination to these 3 points, we can say it's relevant now. Anyhow, then this details like medical background is not compliant with the medication. We already know this thing. These details are important to be written. Again, this one as well. Medicine, yes. We can write down patient seized auditory or visual hallucination, yes. Everything is important over here. And nursing management, yes, we can write. But how would we write down this letter? You can see that in a moment. Of discharge regarding patient name who has responded well to the treatment of schizophrenia and is being discharged today into your care for follow-up. Right? We can write down this thing in the introduction. This will be the introduction to this letter. After that, we can see that as you have the case notes, I'll display. You can see there that we cannot write down the symptom in detail. We can just write down Mr. XYZ, whatever the name of the patient is, right? Self-admitted herself with, let's say, worsening features of schizophrenia. So we're not like normally candidates do this thing. We can write down Mr. XYZ, self-admitted, herself. Okay, not herself actually. Self-admitted with worsening features of schizophrenia. Consequently, she was given, let's say, risperidone, to which she responded well. And now you can write down the symptom like her hereditary hallucination has improved and so on. Afterward, we can write it down in terms of her nursing management. In terms of nursing management, let's say she has been, let's say we can write on the nursing management, she has been assessed for, let's say, behavioral sign of psychosis and so on. And then we can write down the discharge. Let's say she has shown a good progress. Say, however, her symptom can decompensate if she not. And then at the end you can write down the discharge letter, discharge plan. He has been discharged on the following medication, such as risperidone and so on. And in the last you can write down, please do not hesitate to contact me if you have any further queries, right? And then you can write down yours sincerely at the end if you have the name given. Okay, so as you can see that writing tasks. In this class, this is a letter of medicine. We are writing this letter to the nurse in charge. So district nursing services. So and what is the reason of writing? The anticipated needs that has to be fulfilled. So this is a discharge letter. So we have to see that we have dietary instruction, physiotherapy, anticipated needs. So what we have in the anticipated needs, district health nurse to monitor adherence to the post-operative medication, exercise and dietary regime, regular monitoring for the doctor to dietitian and physiotherapist, danger of social isolation, right? And secondly, what we can see there in the dietary plan, we have low diet and all these instruction. We'll see quickly in a moment. Here you can see that the patient had a post-operative recovery. She was tolerating light diet and there was some bruising at the catheter insertion site, no sign of infection and so on, right? So and patient was anxious. So in this regard we can start in the case note now. So as you can see that the patient admitted on this date, these things were important till this point, with reference to the like social isolation. These things are important. Now this point was important for the diet. Treatment that was done is the angioplasty, and these medicine was important for the medicine compliance. So we can start the letter from here and then we can organize the details. I will show you. What you can see there, we can write it down in this form. Let's say I am writing this letter of discharge regarding patient name, whoever the name is, who has a successful angioplasty and is due to be discharged tomorrow, right, for further follow-up. So we can write down this thing in the introduction, let's say. After introduction, we can write down, let's say, post-operatively. She was having routine recovery. Beside, he had bruising at the insertion site. Consequently, it would be appropriate if you could monitor her site of infection or bruising or infection. Similarly, you can say in terms of dietary management, then we can write down about a diet. Then afterward we can write down about the physio, then medicine compliance, and at the end we can write down about the we can say the conclusion, and here you can write down social history and social isolation point. Okay, I hope this will help you out.